Hi, how are you? Although the exact cause of fibromyalgia is unknown, there are several factors that are involved. We know that once fibromyalgia starts its pain amplification and pain sensitivity, abnormal pain messages are carried throughout the body. These abnormal chemical changes in the nervous system are transmitting pain information all over the body through specialized cells. But how does that happen in the first place? Well, that's what I'd like to talk about today. I believe that it's the perfect storm of events that starts the amplification of pain sensitivity. I'm going to address what some of these events are. Think of it as the difference between having your radio turned up to a normal volume, and over time, you turn that volume on your radio up to a very maximum level, and then you leave it there. If you drive past your neighbors with your windows down, your neighbors might think you've lost your mind. But that is how our pain feels to us all the time. Louder and louder until it reaches its maximum volume. So let's talk about genes. Fibromyalgia seems to run in families, but just because your mother has it doesn't mean you'll get it. A number of genes have been found in families with fibromyalgia. Some genes are associated with depression and anxiety, which may explain why certain depression and anxiety medications help reduce fibromyalgia symptoms. Fibromyalgia isn't passed directly from parents to children, but the disorder does appear to cluster within families. It isn't hereditary in the classical sense, where a mutation of a single gene is responsible for a given trait. But genes can predispose us to fibromyalgia in a complex way called polygenic. Normally, a specific gene you inherit from your parents is the primary reason you'll get a disease. But in fibromyalgia, it's not that simple. The right conditions have to be present in polygenic predisposition. That means that other factors must come into play to trigger fibromyalgia. The right set of circumstances or contributing factors will have to occur to take you down that path. According to the MIDI, you have a 33% likelihood of having fibro if you have a close family member who has it. So let's talk about some of those circumstances. Females are more likely to get fibromyalgia, but it also exists in men and children. There are genes that code for the production of neurotransmitters, chemical messengers in the brain that have been implicated in fibromyalgia. Some of them are serotonin, norepinephrine, dopamine, GABA, and glutamate. But there are a couple of things that are important to reduce your risk of fibro. emotional intelligence, and that should begin in childhood. Emotional intelligence is being aware of your circumstances, being aware and in control of your emotions, being able to express how you feel, and dealing with your relationships fairly and empathically. So now let's move on to what are considered the contributing factors of someone who gets fibromyalgia. So let's start with significant psychological stress. This is the one that we hear about most often. People who have endured post-traumatic stress disorder from a terrible event, such as a car accident, or perhaps from fighting a war, have been linked to fibromyalgia. And that's why positive coping skills are so important. Irregular sleep patterns. I often wonder if the irregular sleep patterns start from fibro or after. But studies have shown that irregular sleep patterns can lead to fibromyalgia under certain circumstances and conditions. And poor sleep can contribute to other symptoms of fibro or trigger a flare once you have fibromyalgia. Physical trauma and emotional trauma. About 64% of people with fibromyalgia have experienced trauma as a child. It's believed that our fight or flight system is activated and then doesn't turn off. And being in an abusive relationship can increase your risk of getting fibromyalgia in the same way. About 25% of women with fibromyalgia have been physically as children. In addition, a lack of parental presence or attention can also be a trigger for the onset of fibromyalgia. It changes the way our brain handles pain and stress. Viral infection, giving birth, surgery, a relationship breakdown or breakup, repetitive injuries, or the death of a loved one. I've grouped these together because, as mentioned, there are clusters of events that can lead to fibromyalgia. So some of these can be possible triggers for the onset of fibromyalgia. Autoimmune conditions and other rheumatic conditions. So a pre-existing chronic pain condition like osteoarthritis or any type of arthritis, and disorders like temporomandibular joint disorder or IBS are a few of the possible conditions that lead up to fibromyalgia. But also inflammatory conditions like ankylosing spondylitis, lupus, or rheumatoid arthritis can increase your risk of getting fibro. About 21% of people with rheumatoid arthritis also have fibromyalgia. And people with chronic back pain are also at risk. So let's talk activity level. Are you an inactive person, or has the amount of activity decreased over time and led up to fibromyalgia? Some say this could lead up to or contribute to fibromyalgia. I know that I went from a job that I stood for many years to a job where I was mostly sitting at a desk and then was busy once I got home, but didn't really do any kind of active exercise. Has always made me wonder if that was a contributing factor. So do your best to increase your activity levels. But remember, these are only risk factors. Just because you have one of these conditions doesn't mean you'll get fibromyalgia. And these life experiences may increase your risk, but not alone, because it's a perfect storm of events that leads to the onset of fibromyalgia. If you're interested in how the changes in the brain occur, you can watch this video on brain neuroplasticity. So how do you measure up? For me, several of these have occurred in my lifetime, but just one alone may not create that perfect storm. Or are you one of those people who have said, none of these have ever happened to me? I'd be interested in knowing. Put it in the comment section below. I hope you found this video helpful. I send you gentle hugs and support. Love you. It's people have